right, Governor Kelly, I'll turn it over to you in just a moment. Folks, I do want to let you know that we are streaming on the normal services on Governor Kelly's YouTube channel, on the Kansas Legislature's YouTube channel. And you can also find the audio to this meeting at ks.legislature.org. Click up in the top right at the audio and visual button and click on live streaming. With that, Governor Kelly, I'll let you take it.
Morning, everybody. Let's get the meeting of the State Finance Council called to order. Madeline, could you take the roll?
Yes, Senator Wagle.
Here.
Senator Denning. Senator Denning.
Here.
Senator Hensley.
Here.
Senator McGinn.
Here.
Representative Reichman. Representative Reichman. Representative Hawkins.
Here.
Representative Sawyer.
Here.
Representative Waymaster.
Here.
Governor Kelly.
I'm here.
I'm not sure if Speaker Reichman is on or not. I don't see him on the list of participants, but he may be on a phone number. Speaker
Yeah,
Reichman.
Madeline,
there?
Speaker Reichman is on another meeting right now.
Okay, thank you.
Thank you, Representative Hawkins. Okay, the first item on the agenda is the update on COVID. John Rolfe is here to provide an overview. John?
Hello, everybody. Wish you happy holidays and a happy new year. I know we're all excited to get to 2021, and congrats to all the people from Wichita that survived the earthquake last night there. Okay, so this one should be a shorter update. Still trying to compress 3.5 hours of calls into 5 minutes for you. I think it's still a really strong regional tool. And so as you get the chance, anybody who's watching this, if they want to watch regionally, just go to covid.ks.gov/report-outs, and they can sign up to get the email that has the dashboard for the region, the call, and any extra things. So like, for instance, this week, KDHE had some vaccine scams that they'd seen going on. We were able to attach some information around that. Just a tool in all of your toolkits as you think regionally. As we summarize it really for the state, it's interesting. The healthcare system, I'd say, is both catching its breath and holding its breath at the same time. You were sent the weekly dashboard from the Kansas Hospital Association and the materials beforehand. And a couple things that you'll see there. One, just testing was down to probably 2/3 of what it had been the past couple of weeks, and that's because of the holidays with shortened weeks and all that. Not as many people get tested. But when you flip to the third page of that, you'll see really some bright spots out there. North Central, Northwest, and Southwest Kansas have all really done a good job beginning to come off that surge that we saw in November of total cases. South Central also seeing that, and we saw some easing in the Northeast and Southeast in that way, which has trickled also into the hospitals. You'll see our hospital ICU capacity there on the first page is still right in the same area. It's at 21%. Last week it was at 23%. And anticipated staffing shortages was also where it was the previous week at about 38%. But I tell you, hearing from each of the regions, the hospital systems and the overall healthcare system felt a little bit of an easing. I think they were feeling the squeeze, particularly in the major metros, Kansas City, South Central, and in the Northeast. And they felt some relief to unclog the system. Now, we've had the last 2 weeks Mission Control, which is the software company was created by Cheyenne Mountain Software that KDHE has helped push into our hospital systems to help with transfers. And their data, we went through it region by region. But overall for the state, 2 weeks ago, we were over 2 hours to try and find a hospital when someone was more acute or severe and needed more treatment, to find a hospital bed for them. This last week, that was down to 1 hour and 15 minutes. So you can see we're still close to the edge, but there's been some relief this week, and you could just feel that, I think, across the system. A few more bullet points for you. I'd tell you the healthcare system seems to be functioning well. Stories of them helping each other with specialized PPE needs, which generally come down to the different sizes that are needed for masks or gowns or things like that. And they're also doing a good job transferring patients up and down the system through swing beds, which means after someone is on the path to recovery, they'll move them out of some of the major hospitals back down into some of the regional or rural hospitals for their recovery, so they can create the space in the ICU beds where there's more specialized treatment. I love seeing them work together like that. But I tell you, they're still finding themselves in strange new places. Dr. Bro from Concordia, who joined us, talked about transferring a patient to Hayes by plane, which is the first time she'd seen that in 7 years. Emporia, they'd gone over capacity this past week in the ICU for a time, but were able to find the staff to get through it. And then 3 last points here. The vaccine is both a point of hope and frustration out there. They describe it as seeing a light at the end of the tunnel for the first time in this thing, which gives them a lot of energy. But we heard from several areas about particularly the long-term care facilities who are needing to get it, and the rural areas are not getting enough communication about what they need. And then as far as them catching their breath and also holding their breath, it was mentioned that 90+ million Americans traveled over the holidays, and we won't know if there's a holiday surge for 3 weeks after a holiday. There's also just a non-COVID surge this time of year with potential influenza and other issues that happen around the cold weather. So everybody's waiting to see what will happen with bated breath. 3 things that were encouraged: just the use of the emergency room. We've seen a decrease in people doing that, which had happened before, where people get scared that they'll get COVID going in. And that creates a secondary pandemic of strokes and heart attacks that people have that they don't get treated. So we need to encourage people to do that. The thought that today's choices impact tomorrow's outcomes. And the last, just as I like to share a bright spot, we had a nurse from Hutchinson that was on the call. He was talking about how much the encouragement from the community meant to him and his team. And he mentioned that someone had gotten some kids with some chalk, and in the staff entrance and exit, they just chalked a bunch of encouraging messages there for them to see as they were coming in and leaving each day. And you could just tell how much that meant. So it was great seeing someone invite kids into sharing kindness that way in Hutchinson. That's my report for this week. I'd be happy to stand for any questions.
Okay, very good. Thank you, John. Any questions for John?
Governor Kelly, this is Senator Denning. I have a question for John.
Yes, sir.
Go right ahead.
Thank you, Governor. John, I noticed that the percent positive is way off from what's reported on the KDHE website. Do you know why the hospital system isn't using the KDHE data?
Where are you seeing a percent positive on the sheet? I might be able to get that information for you. Oh, I see it there at the top of the second page. Let me get that information for you, Senator Denning. I know that part of where they're pulling the information is the teletracking data, and so that is only part of the tests that are being used, the PCR versus the antigen. But let me find out more information. I can report back on that to you next week.
Yeah, just for your own edification, antigen is not calculated in the positivity rate. They only calculate positivity based on PCR. Mm-hmm. But the KDHE website is 12.9 and the hospital is 22. So it's a big deviation.
Yep.
Yeah, and it's been like that for a while.
That's a great point. I'll get back to you on that next week if that works for you. It's a great question.
Yep, thank you.
And also, Governor, you'd asked about the reported COVID deaths last week. I think we're going to end up pulling that off of this dashboard. That is just the hospital deaths from the previous day, which I don't know is useful for a report like this.
Okay, thanks. Any other questions for John? Okay, thank you very much, John. This really is incredibly helpful to get this regional data in perspective. It's helpful as we go along. Okay, the final item on the agenda today is the review of an executive order to waive the waiting week requirement for unemployment benefits. And I've got Clay Britton, General Counsel, here to provide an overview and answer any questions anybody might have. Clay.
All right, thank you, Governor. This is Clay Britton again. Council, we're here to review an executive order under the provision of House Bill 2016 that requires that review after an emergency executive order is issued. This EO is really just an extension of a provision that was contained in a previous executive order from back in the spring, as well as a provision of House Bill 2016. A little background, as you know, the CARES Act back in the spring offered federal funding for unemployment benefits for what most states call the waiting week period, which is just an initial week that you have to wait before you start getting your UI benefits. To take advantage of that federal funding under the CARES Act, states like Kansas that had prohibited those benefits for that week had to change their laws to allow those benefits to be paid. So that is what was initially done in March through an executive order. That was Executive Order 2017. And then when the legislature enacted House Bill 2016 in the special session, it incorporated and extended that provision out through to December 26th, because the CARES Act funding for that waiting week benefit was set to expire on December 26th. As we all know, the new federal stimulus package is now in effect, and it extends that federal funding for waiting week benefits out through, I think, sometime late in March, with possibilities for extension beyond that. So this EO just continues to extend that suspension of the waiting week requirement so that we can continue to take advantage of what is now a 50% federal funding match for those benefits. It'll expire either when the governor rescinds it or when the state of disaster emergency expires, or if things change on the federal level, we can review it at that time. I think those are the highlights, and I'm happy to answer any questions.
Okay, any questions for Clay?
Governor Kelly, this is Denning. I have a quick question for Clay.
Go right ahead.
Clay, when we left session, we extended the benefits by 10 weeks. I think Kansas is 16 and we added a 10. Can you remember when that 10 expires?
That's a great question, Senator Denning. I don't know off the top of my head, but I can take a quick look at House Bill 2016 and maybe get back to you offline if that's okay.
Yeah, that would be fine. And then the other question is, not having that 1 week waiting period, do you think that's adding to the fraud activity?
Holiday surge and what that looks like. Really what that surge comes the next 2 weeks, as it takes 6 to 8 weeks to unclog the healthcare system. This will tell us what our healthcare system experience will be like into the spring. I think we especially need to be watching Southeast Kansas as it looks like they had better early numbers compared to the state, and now they're starting to see that rise. And last but not least, bright spots, just as far as caring for people in Phillipsburg, floor shop donated floor arrangements to long-term care residents who were not able to see family or visitors over the holidays for both Thanksgiving and Christmas. And in Gove County, anonymous donors provided pizza for all the hospital workers as well. And those little acts of kindness go a long way when it's from your neighbors and your community. And the final message here, just as I think I walk away from the calls this week saying, hey, it's a new year and it's time for a new commitment just to continue to do what we can in communities to stop the spread and really care for our healthcare system, as we know it's impacting not just COVID patients, but all patients. And that's my report. I'm happy to stand for questions.
Excellent, John. Thank you very much. Any questions for John? Okay. Let's move on then to the executive order that will extend regulatory relief to motor carriers. I've got Clay Britton here to provide an overview and answer any questions anybody might have.
Thank you, Governor. This is Clay Britton. Again, Council, we're here to review an emergency executive order under House Bill 2016. This is one that you've seen in various forms throughout the pandemic emergency related to motor carrier relief. This regards sort of licensing and permitting requirements. So vehicles that are actively involved in pandemic relief efforts, including things like vaccine distribution, PPE distribution, are relieved from having to comply with some of those normal licensing and permitting requirements. We do this to sort of track what federal authorities do in their emergency relief orders related to motor carriers. And by my count, this is about the 8th version of this executive order since we've sort of been tracking and following along with what the feds have done. So no real substantive differences here. This one goes through February 28th because that is the date that the federal resolution goes through. And then we may be back talking about another one at that time, depending on what the feds do and what things look like. But this will be what takes us through to the end of February. I'm happy to answer any questions the council has.
Does anyone have any questions for Clay? Okay, that's all we needed with that. We are going to move into executive session for Tort Claims Act issue. But before that, I do want to let everyone know, in case you need to get off this call before we're finished, that there will be no State Finance Council meeting next week. I think trying to coordinate legislative and executive branch schedules is a little difficult during that first week of session, so we'll let it go and reschedule for the week after. I would also like to recognize that this will be the last State Finance Council meeting for several of you. Senate President Wagle, Majority Leader Denning, Senate Minority Leader Hensley, who is not on the call today, and Senator McGinn. I just want to tell you it's been my honor to work with you, and I look forward to maintaining relationships with you as we go forward, obviously in a different manner. So, and I welcome back those of you who are on the call who will be at the next State Finance Council meeting. So with that, the final issue that we need to consider at this meeting is the request of the Attorney General for approval of a tort claim settlement. Before we hear a motion to go into executive session, Gabe Dorsey is going to let us know how this will work via Zoom. Gabe, are you there?
I am, Governor. This will be relatively easy for all of you. I will pull you into a separate chat room, as I explained at the beginning of this meeting. The live stream will continue in this chat room, but you will be in a virtual private session. And then when that time has expired, I will pull you back into this so that you all may continue the remainder of this meeting.
Okay, I need a motion from a member to go into executive session with an estimated time frame. The text of the motion is on page 2 of the meeting materials that were emailed to you. Representative Waymaster, I think you're the man.
All right,
Okay.
Thank you, Governor. Do we know exactly how much time we'll need to be in executive session?
10 minutes.
10 minutes? Okay.
Yeah.
I move that the open meeting of the State Finance Council being held by Zoom be recessed for a closed executive meeting pursuant to KSA 75-439A for consultation with the Attorney General and members of the staff of the Attorney General to discuss matters relating to a proposed tort claim settlement under consideration pursuant to KSA 75-6106 under the justification listed in KSA 75-4319B2, because discussion of such matters in an open meeting would waive attorney-client privilege. that the State Finance Council resume the open meeting being held by Zoom at 10:05, and that this motion, if adopted, be recorded in the minutes and be maintained as a part of the permanent records of the State Finance Council.
Okay, very good. You've heard the motion. Is there a second? Is there a
Representative
second?
Sawyer seconds.
And I would second.
Okay. All right, I heard Representative Sawyer first, so that's Representative Sawyer second.
As a
And
part of the
all in
permanent
favor?
records of the State.
Any opposed?
Aye.
Okay, we'll go on into executive session.
Representative Waymaster, it looks like you're the only one who has not joined.
I haven't been switched over.
Was there not a notification for you?
Let me check. Is it by email?
No, it should have just popped up as a notification on your computer. That's what you're.
Is there any way it
in
can be
from,
resent,
correct?
Gabe?
Let me try real quick. I'm not seeing anything.
I wonder if
You
it
don't
makes a
have a
difference.
notification up.
Not
What's that?
popping up in Zoom, no.
Okay. I'm frankly at a loss. Let's. I'm gonna close it out and then I'm gonna retry it.
Okay.
I have you on my list, but I'm not sure where the disconnect is.
Okay.
I do apologize. I know this is bothersome.
I just thought it would automatically transfer me over to the closed session.
I did as well. Sometimes there's a button that you might have, or a notification that pops up and you click and accept down up towards the bottom of this screen. But give it 10 seconds here and it'll pull everyone back out and then I'll reassign.
Okay.
Hi, folks. I do apologize. We had some issues getting Representative Waymaster into the meeting, so I'm going to try this again. Please keep an eye out for a notification on your screen.
You know, Gabe.
Although I do think. Yes,
Gabe,
Governor.
I'm thinking we ought to go back into the main session.
This is the main session, Governor, just so we're all clear. And then if you would like, I will move everyone back. We just had some sort of glitch along the way that kept Representative Waymaster out of the meeting.
Okay, my question is, Representative Waymaster, would you be willing to do another motion and extend the time that we've got for the executive session?
Yeah, I can do that until 10:10. I take it I have to reread the entire motion.
Why don't you do it for 10:15, just so we can account for any more technological problems?
Okay.
And yeah, why don't you just go ahead and extend the time rather than reading through the entire motion again?
Okay, I move that we extend the time for the closed session until 10:15 a.m.
Okay, we have a motion. Is there a second?
Denning seconds.
Okay, Senator Denning seconds. All in favor?
Aye.
Aye.
Opposed? Okay, Gabe, you're on.
Yep, we're gonna try this again. Please do keep an eye out for anything that pops up. Here we go. Folks, please hang tight as everyone exits the executive session. One moment.
Okay.
All right, everyone. Oh, sorry, Governor. Go ahead.
No, go ahead, Kate. Tell everybody what you need to tell them.
Excuse me. We've exited the executive session. We are now live streaming back for public viewing. Governor.
Okay, and everybody's there, I'm assuming. So I now need a motion to approve the resolution for the proposed settlement in the case of Hill versus State et al. Is there a motion?
This is Representative Sawyer. I move that we approve it.
Thank you, Representative Sawyer. We have a motion. Is there a second?
Second, Senator McGinn.
Senator McGinn seconds. Madeline, could you please take the roll?
Senator Wade.
Aye.
Senator Denning.
Aye.
Senator McGinn.
Aye.
Representative Reichman. Has he left the meeting?
Apparently, yes.
Okay. Representative Hawkins. Sorry, he's out. Representative Sawyer.
Aye.
Representative Waymaster.
Aye.
Governor Kelly.
Aye.
We have 6 votes in favor to approve the tort claim settlement of Hill v. State, and the motion passes.
Very good. Thank you. Okay, that concludes the January 6th State Finance Council meeting. I need a motion to adjourn.
Governor Kelly, this is Representative Waymaster. I move to adjourn the meeting of the State Finance Council.
Representative Wayman.
Second, Senator McGinn.
Second. All in
Second.
favor?
Aye.
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 Okay. Happy New Year, everybody. See some of you next week and talk to the rest of you at some other time. Take care.
Thanks, everyone.